Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Dr. Volker Menzel is a dentist with more than 30 years of clinical experience with a professional focus on implantology and periodontology. His approach extends beyond conventional dentistry and is strongly shaped by his long-term personal experience with nutrition-based health optimization. Through 7 years on a ketogenic diet and 5 years on a carnivore diet, Dr. Menzel fundamentally improved his own health and reshaped his understanding of disease prevention and metabolic health. In his mid-40s, he faced several health challenges, including prediabetes, excess body weight, polyneuropathy, and retinal microvascular damage. Through these combined changes, he was able to normalize metabolic markers, achieve sustainable weight loss, and heal his neurological and vascular symptoms. Under the name The Carnivore Dentist, Dr. Menzel and his daughter work to educate and inform about the connection between nutrition, oral health, and overall well-being. Their aim is to empower individuals to better understand root causes of chronic conditions rather than focusing solely on symptom management. You can find Dr. Menzel at www.thecarnivoredentist.de. Dr. Volker Menzel, what an absolute honor it is to welcome you to Boundless Body Radio.
It's an absolutely honor to be on your show.
It is an honor to host you. Question number one, did I pronounce your name correctly?
Yeah, Dr. Volker Menzel.
Volker Menzel. Okay, I was close. I'm not even that confident. I'm not even that confident that I said your last name the same way twice in the same conversation. So I really appreciate you coming on.
Yeah, I really appreciate to be on your show. So it's great.
Yeah, that's awesome. Before we started recording, I was telling you about a bit of an event we're having in my neighborhood today where there's a grouping of, it's got to be in the six figures. There's tens of thousands, hundreds of thousands of birds that all travel together at one time. And they're on every roof that I can see. They're in every park all at the same time, and they're flying around everywhere. You said you've had some adventures with birds in the past. You offered me some great advice. And I think it'd be great advice for our listeners to hear your wonderful bird advice as well.
Yeah, actually, a couple of years ago, we had the same thing around my house here. And it was so annoying because it was so loud. And I just went out and said, shut up. And they did. And
That's
only
amazing.
for a couple of seconds, but I recorded it. So I had the situation. I went out and said, shut up. And it worked. So I ran in, got my phone and recorded it and did it again. And it worked a second time. So
Okay.
go ahead and try.
Yeah, temporary relief. If I yell shut up, just know I'm not yelling at you to shut up. You can keep talking. I'm talking about the birds. And you're calling, yeah, I appreciate that. You're calling him from Hamburg in Germany, correct?
Yeah, absolutely. Yeah.
Awesome. So you are actually the second person we've hosted on this show that is a carnivore in Hamburg. Pretty cool. His name was Olaf Koch. It was amazing to talk to, and he cured a lot of his digestive issues on a carnivore diet. Does this mean that the carnivore diet is super prevalent and really catching on in Germany, or not so much?
I would say not really. There are very few. I have only one patient and just got in because of my interview with Dave Mack. And she just came in and said, well, it's really funny because you're the only guy I know who eats the same weird way that I do. And I answered, well, actually, except of my wife, you're the only one too that I know who eats the same way that I do. So it's not very common. And usually, as probably a lot of carnivores know, that's really, really, for the most people, it's unbelievable to eat just meat. And that's why my hobby is to get to find reasons why the biology of the human says, well, it's the way you should go to. And sometimes I think I found some reasons for that. And I would love to talk to like Bart Kay or someone who really is perfect into biochemics, chemistry to understand that, to give me a yes or no whether this is the reason for us to be carnivores. So yeah, so
Yeah, it's interesting that you mentioned wanting to share this message. There's not many other topics of discussion that I find that people learn about, apply in their own life, and they get so excited about it that all they can think about doing is finding a platform, like starting a podcast, doing a YouTube channel, starting some kind of social media to try to get the message out because it's so critical and so important in their own lives that the only thing they want to do is share it.
yeah, and it's as anybody said, well, you want to tell everybody because it works so great, and nobody wants to listen to you. So everybody tells the same story, and Well, what I see when I'm in my office, I usually, as I said, I'm a periodontist, so I do a lot of surgeries. And for the healing process, you need a lot of collagen to heal perfectly. And then when you think about it, how collagen works in your body and how it is produced or destroyed, and then you see all these pathways which were good or bad. And then you find out, well, it's got all these connections together, and that's why the reason why you have so many people with the same situations, although they're totally different. But then you find out that 20% of some people, of a group of some people, actually have the same problems. Then you go try to dig deeper, and then you find out, well, that works really well, and to understand why they have these problems, but still they won't listen to you. So to get this message out by you going online was probably one way to get myself to try to educate at least some people, because I usually, or I do for about 20 years now, I train periodontists to become better, to do this kind of surgery stuff. And I've got a group of teachers who teach other clients how to do these surgery things. And everybody is talking about how you do the surgery, how you do these kind of surgical procedures, how you cut, how you suture, and all that. But what I asked when we met last year, because we only meet once a year, I asked, is there anybody knowledgeable about why we have some problems with some patients? Because when you see the statistics about in Europe, it's about 75% of all people in Europe are metabolically ill. In the US, I think it's like 90%.
Yeah.
So basically, even if we do normal things like extracting a tooth, not even weird stuff, we're working on sick people. And what kind of problems do we get with these sick people when we do normal surgery or normal stuff? Even if you cut your fingers and they get problems, or the wound doesn't heal as it should be. And if you think about it and you try to understand all the biochemistry behind that, it's far more interesting to find out how this healing works than after 30 years of doing all these procedures. It's not really, well, it is interesting for me because that's why I love to do it, but actually, it's now after 30 years doing the same thing over and over again. Um, it's not that interesting for me anymore to do all this stuff because it's not getting boring, but you get used to do it. And so it's no different for me to do one implant or 10 implants or do one small surgery or one big surgery, or it's not the point. But when you talk to colleagues who teach all the same things, they do not know anything about this situation that 75% of Europeans are metabolically ill. And we have to solve these problems, especially in vulnerable groups. And we come to this probably later, which I think are vulnerable. Um, but it's really funny because there's only one oral maxillofacial surgeon in this group who said, yeah, I thought about that too. And I think we can do it with like vitamin C infusions and all that. And yeah, exactly. Mm-mm. It's not the way because the body produces glutathione, which is a far better antioxidant, and it's that got no other problems like high doses of vitamin C. And if you understand how vitamin C is works in the body and high doses, what they can actually do, it's not the best way. But everybody here, especially here in Germany, I know I don't only know that here for Germany, but there are more and more people who think that a biologic approach to dentistry is taking out root canal treated teeth or taking out titanium implants. And I say, okay, you take out a tooth which is not perfectly, but it works. Do you think you can heal them when he's got diabetes and blood pressure medication and all that stuff? So, in my opinion, you have to change this problem first. Then you can decide whether it's necessary to take out special teeth and do other kind of procedures. But as a dentist and focused on dentistry, it's like an the eye doctor, sorry. uh, they only think about their profession. And it's not a thing if you've got only a small practice or you're the professor of a large university clinic. You only think about your business and not about the whole body or the whole problems that they have. And as I said just today to a patient, doctors are not trained to desubscribe medications. They only put one medication on another and another and another. And 2 years ago, I was on a speech from a guy who was very well known worldwide for these connections between. Oops, sorry, that was so. Where did we stop? What was it?
Yeah, yeah, yeah. Bit of an interruption, but we were kind of talking about somebody 2 years ago was giving a speech. I want to say something along those lines.
Oh yeah, and this guy 2 or 3 years ago, and he said, "Well, we actually have after two and especially after three combined medications, there is no study, no informed information about how these three different medications work in conjunction and how this really affects the body. And the more you put on top of it, there's absolutely nobody in the world who really understands how these side effects of every medication can affect other things and your whole body. So, and I see patients who have got 10 medications, sometimes the same from different doctors at different times in the day. So I don't think they talk to each other. So it's really, really, really weird and dangerous, in my opinion, especially when you think about some guys who get rid of all these medications. I don't know if you've heard about the story from Gary Bracker with the who's he's the he's a biologist and he does all these metabolic therapies with his team because he's only a biologist, so he can't treat patients. And he treated the guy from the UFC, and he got him rid of all these chronic inflammation situation. I'll get him off all of his medications. Uh, so what's his name? White, I think, in the second name. So the guy from the
Dana White, he's the
oh, yeah,
commissioner of the. Okay.
yeah. And he told this story publicly, so everybody knows about it. And it was so great because he's not lacking money, obviously, but still, all the doctors prescribed heart pressure medication and all that, and it took him just a little bit to fix that problems because there's some biochemical pathways in his body that were blocked. So they unblocked it, so and they worked, so he doesn't need any medications anymore. And this demedication thing is hopefully coming up, but well, I'm just a dentist, so I'm not allowed to talk patients out of medications, and I will never do that. I'm not allowed to. I'm not even allowed to talk about real food or changing your diet. So I only can refer to books and probably my channel now next week, so that they can find about it. But it's difficult, but it's very, very important. Especially as you said in the introduction, I changed my life totally. I changed the diabetes of my father. So he was 20 years insulin dependent, and within 6 weeks, he stopped his insulin. He was had a dementia, beginning dementia, and it was after 1 year it was gone.
Wow.
So with my three kids on the table, and they were laughing and shouting and all that. And at the beginning, he was unable to follow the conversations. And after about a year, he had the fun of his life because he enjoyed it so much when the kids were running around and screaming, and he understood everything. So it's fabulous how you can change it. With my wife, she had migraines, very bad migraines for 40 years. And after going carnivore, it was gone. Totally, absolutely gone. So it can help
Wow.
so many people. So if anybody listens to that, please try it. Get yourself educated. Find a good coach who can tell you how to do it. And if you get obstacles in the way, just get put him aside and find a way to get through that, and then it's amazing. It's really
Yeah.
amazing.
It
So
really is. That's incredible. Well, thank you for all of that. I did want to go into a bit more detail about your, the crossroads between your professional career and also your health career. So, in your opinion, as you look back, kind of what put you in such a state of like poor health, and yeah, how that tied into also your career. Being a dentist, you're in people's mouths all day long. Were you ever told that nutrition would affect the mouth? It seems pretty obvious, but nobody's ever told that.
no, it's funny because if you go to university, then they say, well, if you eat sugar, it's not very good because you get cavities. Well, the pretty simple solution is stop pouring carbohydrates down your neck. And if you have periodontitis, the same thing. What nobody, or not many people know about is that if you've got yeast or fungus in your mouth, they use up all the oxygen by fermenting carbohydrates. And that's the situation where the anaerobic bacteria who do not like oxygen, they can thrive because the yeast takes away the oxygen. But if you have got no carbohydrates for the yeast, there's no situation for the bacteria to get out of this situation with the oxygen. And then they can't thrive on it. So the easiest way to just get rid of your periodontal disease, which a lot of carnivores tell about, is that they get rid of all these periodontal diseases just by changing their diet. And that's the same thing. If you get no carbohydrates, the bad bacteria cannot thrive. And that's why oil pulling, for example, works so extremely well. Because the probably most carnivores know if you have MCT oil in your coffee, like bulletproof coffee, this caprylic acid, this C8 caprylic acid, is a real good detox for these bacteria and these yeasts because it destroys the outer laying of the membranes of the bacteria and the yeast. So it destroys them, but only the ones that are vulnerable to the caprylic acid. And the good ones are not very destroyed by this. So you this is just a good pressure to go back your oral microbiome back to normal, and then you have better chances to produce nitric oxide by changing your diet because nitric oxide does is produced in the mouth when you reduce nitrates and nitrites. I think so. My English is not that perfect, but at the end you produce nitric oxide, which is pretty healthy for your blood pressure, and that's why it's sugar or especially fructose is so bad because it destroys or it stops the production of nitric oxide, and then you get high blood pressure. Mostly the most doctors do not know this because I think it was found out 2011 where they really found out how the fructose is metabolized in the body. So usually nobody in practice who studied 20, 30 years ago knows that fructose is that toxic. So, and it's toxic for your mouth, it's toxic for your body. It has to be detoxed in your liver because no cell in the body needs it except of the sperms in your body, because maybe that's evolutionary advantage. Because when the fruits are ripe, then you probably get easier pregnant. So that might be a good reason for that. But in the end, it's just stop pouring carbohydrates down your throat, and then if you don't have them, then you have no problems with these SIBO problems, which I see quite often if you talk to these patients and you get all these informations about these chronic inflammations, which I see in the mouth. Because if you have chronic inflammation in the body, usually you see periodontal problems. And when you see these periodontal problems, I always ask them if they have got digestive issues. And more often than not, they say, well, yeah, if I eat whatever eggs or beef or lentils, I get bloated and I get pain and all that. And if you understand how that works, they say, yeah, of course you have chronic inflammation in the body. You have a leaky gut because your body produces zonulin because you eat a lot of grains. Yeah, so these connections, then you see the problem with this zonulin production because of the gluten, and then you get this zonulin. And in my opinion, I haven't found any really good papers about that. But in my opinion, if you have a problem with the zonulin in your gut, then you have it in your mouth. It's the same um, situation. So then you get destroyed, your tight junction get destroyed, even in your gum. Then you get a leaky gum because of the zonulin production. And probably you even get a leaky brain because of the zonulin production. And at least you get a leaky brain when you have problems with your gut because you have got usually a lot of histamine in your gut because your gut lining is destroyed because of the ammonia that's produced and when you have SIBO. And then you get a leaky brain because of the high histamine. And then you get all these mental problems and brain fog and all that because of the ammonia, which can travel up to the brain and destroys these biochemical pathways up there. So, and that's what we often see that they've got inflammation, they've got headaches, and they've got migraines, they've got chronic inflammation, they've got inflammation in their joints. So, and if you combine that all together, then yeah, I treat periodontal disease, but the root cause of all these stuff that these chronic inflammation they have is actually always the same. So there's no difference whether you have arthritis or you have periodontal disease or you have whatever psoriasis or you have Crohn's disease. Actually, it's always the same root cause, and it makes actually would have made it so easy if you just change your diet, then you get rid. And when you if you have you see listen to Alessio Fasano from Boston, who trained or who is into the zonulin stuff for over I think now 15 years or something like this, and he got all these connections because of the position of this gene from zonulin, which is on chromosome 16. And then you see all these chronic inflammation or chronic problems, which also located on chromosome 16, like triple A positive breast cancer, multiple sclerosis, and all that. And then it makes so much sense that it's all interlinked in between. So um, I only can treat a small part, but I try to teach the patient that there's a lot more underneath that, like rheumatoid arthritis, and then they get all these medications that always destroy your whole mitochondrial situation, and it's really, really weird, and especially hard for me not to tell anybody to change their diet or to change the medication or change the doctor, because most of the time they really got stunned because a dentist who's supposed to drill into teeth tells you something about your mitochondria, your especially the women when I tell them about your estrogen problem because of their gut problems and because of their situation with menopause and what changes there. And but a lot of menopause, premenopause, or postmenopausal women have a lot of problems with their collagen production, which really influences my job because I do all these surgeries. And if you have got poor wound healing because of the lack of production of collagen and all these chemical pathways would interrupt with the production of collagen, then you actually, it's no wonder that you have got all these osteoporosis people and all these recessions on the gum and all this bleeding because of zonulin and because you have the lack of collagen, then you cannot heal. And then it's getting worse and worse. And then you get medication for reduce of your bone loss, of your osteoporosis, which makes it even worse in other parts of the. But as long as no doctors talk to each other, they describe their medications. They usually do, and they do not talk to others who decide, well, it's not a good idea because of this and that. And nobody learns about nutrition as a doctor during the
Wow.
whole. 10 years you get your degree. And as a dentist, it's all the same thing. We do not learn anything about nutrition, although, well, we are the first part of the nutrition because the first contact is the mouth. And even then, we did not learn to stop eating carbohydrates. And as you, as a professional coach, and when you see all these great results when you stop eating carbohydrates and the how powerful you get and how the endurance explodes. You do not need to carb load, or you have to, or you run against the wall after a while because all that it's gone. It's so funny, but so it's everything is interconnected. Whether it's your sports stuff like I do, I went free climbing after I went carnivore or keto. Then I lost a lot of weight. I gained a lot of muscle, so I put on like 20 kilos of muscle. So I'm more fit now than I was when I was 30, and I'm almost 60 now. So it feels quite well.
Amazing.
It feels good, and it's so amazing. And
Yeah,
yeah, well, you know it yourself, but it's your profession. But I just feel happy that I'm still as good or as fit as most 20-year-olds in the gym. Although a
amazing.
lot 20-year-old boys do not look like 20-year-old boys,
True.
but they lack so much carnitine. And when you know what carnitine does to your body, or the lack of carnitine does to your body, and then you understand all these problems that we actually have all around the world, and this can't be discussed on another level, but or another channels probably.
Yeah. Wow.
It's just a biochemical thing, and it's not really good, and it's impacting our problems because then you get your crowded teeth because your jaws do not evolve because your lack of carnitine and your lack of testosterone and the way you grow, and it's not your jaws are not able to grow enough to get space for the teeth. And so that really has also an impact because it does not change within one generation. The genes do not change in one generation, but you see that, like Weston Price found out, that the jaw changes within one generation.
Yeah.
That can't be your genes. It must be something else. And I think it's like carnitine, testosterone, and all the stuff that's impacting your bone health. And when you know that the carnitine affects your bone growth and protects you from osteoporosis, then it's not a good idea to stop taking carnitine or eating carnitine within the meat.
Yeah. Wow. That's yeah, amazing. Thank you for
Sorry.
sharing all of that. It's such a mess out there. You're right. Like what you're describing is such a spiral of negative things that all have that same root cause, like you were saying. I'm just curious. Like we mentioned, I believe it's been about 7 years since you found a ketogenic diet, a carnivore diet, about 5 years. What was it that led you to start exploring, and how were you able to find, information, good information about, the ketogenic diet and the carnivore diet in particular?
Well, when I was 45, so 12 years ago, I had the problem with my own health. And then I decided, well, I have to change something because I don't want to take medications. That was not in my views to do. It was stupid. So that's when I changed it 12 years ago. And at the beginning, there was when I went online and all see all these guys, they all were talking about keto. So I had carnivore not on my mind at the moment. And then I changed all my body composition. I got healthy. I got all rid of all the problems that you said in the beginning. I solved the problem with my dad, who had cancer 4 or 5 times, and brain cancer, kidney cancer, and metastatic problems with the kidney cancer. And after he went keto, it did not occur anymore. It was gone. Not only his dementia was gone, but he had no reoccurring cancer problems anymore. And though he was 82, he changed his diet because he's also a dentist, and I was able to convince him that it's a good idea, and he understood that the Randall cycle stuff and all the Wahlberg effect that your tumor cells are not able to digest ketones. He said, "Well, it sounds reasonable." So I just stopped it, and then he stopped it the next day. So it was very easy to convince him. Um, yeah, but in my case, after I think it was Ken Berry, I think, or it was Sean Baker, um, which is he's amazing. Sean Baker is amazing, and Ken Berry is also amazing. But because I love sports so much, and as I said in the intro or before that, I don't like to see people doing sports. I find it so annoying. I love to do sports by myself. I love windsurfing, surfing, free climbing, Muay Thai, and all that. And I hated to see other people doing that and sitting on the couch. It's like it's a no-go for me. Um, and so when I saw that what Sean Baker was doing with his age at I think it was now he's almost 60 now he was 55. I'm just 2 years younger than he is. So I say, well, that's my thing. I have to do that. I have to try that. And one particular thing was really funny because sometimes you have to find the real thing to really get you convinced to do it. And that was my story about my treat, which was macadamia nuts. So I was full carnivore except of macadamia nuts. And I said, well, some macadamia nuts a day is not that bad. But I got a bruise in my right foot or my right big toe, and I got these problems like gout problems, but only one on the right side, and it was the one that I got the bruise on. So, and I say, well, it's annoying. It doesn't go away. I can't put like creams on top of it, and it doesn't work at all. And then I read the book from Sally K. Norton about the superfood, toxic superfoods, about the oxalate stuff. And I say, well, that's convincing. So it might be the coffee or it might be the macadamia nuts and sometimes black chocolate as a treat. But so let's try it. So I stopped everything. I stopped chocolate. The little bit that I have once a day, just one piece because I love them so much. And I think for me, it's just like life. It's just, well, I'm not Anthony Chaffee who stops everything. I just have a glass of wine once a month or when we have birthday present or whatever. Um, and then I stopped these macadamia nuts. And after 6 weeks, I woke up in the morning. I said, well, there's something strange happening here because I don't feel my toe hurting anymore. And then I say, well, okay, I waited a week and it was gone. It never came back for this whole week. I said, okay, let's make an n equals one. And I reintroduced it macadamia nuts. And it took me one day and the pain came back. And that was so eye-opening. So actually, why do we do that to our bodies? Because these oxalate, they used to, or they tend to go to these inflamed areas. And then I stopped it again. It took us 4 weeks and then it was gone. So the last time I had macadamia nuts was 4 years ago, something like this.
Wow.
And now I'm not absolutely perfect lion like my daughter is at the moment. Because she got this as a present to join the group from Steak and Butter Girl. And she got that as a present. So then she said, well, okay, I'll go into perfectly. And then she did all that stuff. And what was really interesting for me, because during her transition, she got a lot of oxalate problems. And then I tried to find out how carnivore or high fat carnivore and this priming, where you eat a lot of meat as much as you want to get your body back online to know that the body has got enough nutrients. And then she had these weird problems with first with her skin. So they got these classic oxalate dumping problems. Um, and then we made a blood test for her because we wanted to know what's going on. And then we found out, well, her B6 is quite low. And I said, okay, what's the reason? Does it have anything to do with oxalates? And then you find out that if you have a low B6, you cannot convert the, what's the name? The precursor of oxalates. You cannot convert it back to the amino acid, which comes from. So the only way left because of the lack of B6 is to go to produce oxalates. So your oxalate level go up because your B6 level is low. And that was one thing. So that's why she had a lot of oxalate. And one thing that I found out also is if you're on a high fat carnivore diet, which is usually absolutely perfect for your hormones and all that, you have a process called in Germany, it's like calcium fat soaping. So the calcium connects to the fat, and then you do not have enough calcium to bind to the oxalates. And then you've got far too much oxalates in your digestive system, which gets into your kidneys. And if you have high oxalate in your kidneys, the kidneys cannot reabsorb sulfur. So you can't get back the sulfur, so you get low in sulfur. And if you do not have enough methionine from your meat to fuel the transsulfuration, so transsulfuration pathway, then you're running out of that and you cannot produce bile anymore because you cannot have not enough sulfur to produce taurine. And taurine is necessary to produce bile. And then you can fix these problems because you have not enough bile to get to digest all the fat. Because usually it's a good idea to do a lot of fat, but if you have not enough bile production because the lack of taurine, because you have these connections, then you're in pretty deep problems. And to find out, because I sat down and said there must be something wrong with this situation, and I dig deeper and find out these situations that well, it totally makes sense that in certain situations you have to go slow on your fat and not overdo your body with that. And then she reduced the fat situation a little bit, and then she took calcium citrate to get the calcium back in your colon to bind to the oxalates, and now it's much better
Wow.
without putting oxalate back into the body to stop the oxalate dumping, but also to put the calcium citrate in to get enough calcium in the colon or in the gut to bind to the oxalates. So
Yeah.
it's so interesting and it's so difficult to find anybody to talk to. So you have to listen to me now.
I sure do. No, that's fascinating. I love the way you explained all those, steps in the pathway. I think is absolutely fascinating. You're right. Not a lot of people know that. I didn't know how all of those things were related. So yeah, I do absolutely appreciate that. Yours was macadamia nuts. Mine recently was cashews. I got into, starting to bring cashews back into my diet. And boy, the next day after eating cashews, which would be way too much, by the way, I think I was just going to get a handful and I wouldn't be able to stop myself until I had like five, six, seven, eight handfuls. And then the next day, my digestion just hurt, was so poor. I had to stop bringing them in the house and buying them. And then all of a sudden, my digestion got way better. It's just funny how we do those things to ourselves. So it's great that you did that experimentation. And on that note, you mentioned your wife, you mentioned your daughter, other people that are in your sphere, in your household. When you start to make a conversion to a carnivore diet, it feels amazing. You want to share your message like we talked about earlier, but sometimes that can turn people off. Sometimes people are not ready to change their diet. So what was it like for your wife and for your daughter? You're seeing all these amazing changes. What advice, how did that go in your own household? And what advice would you give to other people out there on carnivore who would love to influence those people nearest to them, their friends and family, without, preaching or proselytizing, if that makes sense?
Yeah, and that's really the most difficult part because you can be knowledgeable as hell, but yeah, if you preach the prayer, it doesn't work as if they do not want to listen. So you only can tell them, please listen to somebody else. Don't listen to me because you know me and you don't think that I'm well educated. You find somebody else. It makes more sense to find somebody else. Read as much as you can. Listen to all different kinds of information you can get about that. I can provide you with books or with anything else, but read them first because if you want to learn something about it, learn before and then we can talk and then I can help you. If you only say just do as I say, well, if you have got I've got three kids, they never did anything that I or my wife say because they won't listen. And if you get older, well, ask my wife, I never do what she said. So it took me quite a quite a lot of years to convince her to get rid of all her yeah, treats or whatever. So she was never, she always said, well, I don't like plants at all, but I have to eat them. And we had usually, as we said, when you have three kids, now they're old enough, but in the beginning we had bread in the morning and all that. And when I stopped that, they said, oh goodness me, how do we handle that with all three kids? That's impossible. And then I say, well, I don't care. I go my way and it feels good for me. And after, I think it was 5, 6 years, and then she said, okay, I give up. I tried also. And then she went into keto, and then we tried this keto stuff, and we did keto bread, which is horrible for the oxalate dumpings or the oxalate load with his almond flours and all that. It's unbelievable if you've got these corn stuff, then it depletes you from zinc. So if you probably not everybody knows about that, but if you eat corn, your zinc absorption goes to zero. And if you have a little bit of knowledge about these cycles that are necessary to produce something, for example, like glutathione, well, you need magnesium, you need B6, and you need zinc. And if your zinc resorption is zero, then you get into these problems, and suddenly there's just one fuel missing, and the whole circle stops. And if you provide it, then it's okay. But if you eat a lot of corn, it's really can get a problem, can get really, really messy. And after we dropped that and we went more and more to carnivore, it got better and better. And when I had Corona in 2021, I think, in about 5 years now. So I was at home, I was ill, I was sitting there, I was fasting because I said the best thing if you're ill is stop eating, get into deep, deep ketosis. And then I get my ketones up to 5, 6 millimolar and my blood sugar down to 50. And that's how I usually treat my inflammations if I do have any kind of infections. Then I stop eating and I get my ketones up and I take a little bit more of MCT oil to push it even higher and to get in therapeutical ketosis. And it works usually pretty well. And that was the time I say, okay, stop all plants, go full carnivore, except of the macadamia nuts, which took me another year to find out. Now, well, when you're feeling so fit, especially when I do free climbing, it's so funny because every time I do not comply to what I should do and take some carbohydrates in, then my forearms, when you go climbing, you're sitting or you're hanging on your fingers, and your forearms get totally pumped, and there's nothing you can do about it. But if you're deep into ketosis, when I go in there fasted, it doesn't happen.
Wow.
I don't get pumped arms, not at all. They I lose strength after a while because usually these climbing stuff is really, really intense. So you can climb 10 meters and you always find out the route that you almost can't handle, and then you try to get up there. And but sometimes you stop in the middle because you say, well, it's impossible to hold this anymore. And the other time when I'm fasted and I took a little bit like 10 grams of carnitine, of creatine, my mind is much better. I'm far more focused. I stay on the wall far better, use less energy, and I feel amazing. And sometimes that really, and I couldn't believe it for myself. So I tried it a couple of times with or without carnitine and with creatine, and it works. It's great, but only if I'm fasted and had no carbohydrates in. And even 5 grams of carbohydrate do change this. So
Fascinating.
yeah, it's funny. And
Yeah.
because I do it 3 times a week, I can change it every time and find out and tweak a little bit here and tweak a little bit there. And it really does make a difference how you program your body. And even in this area where you say I'm carnivore for 5 years, it does make any it must it does make differences whether you do this or that, or if you ingest the food before you do sports or afterwards, or sometimes just a little bit of steak and then the big steak after the sports. So it really does make a difference, and it's great for your clients to have you, because you can tell them what to do and to explain them how it works. Yeah.
That's awesome. Wow. Again, thank you for explaining that. We've got about 10 minutes left in this conversation. I really wanted to make sure we left time for you to discuss some of your work around TMJ, which I don't think also a lot of people would associate with diet. And I know you've done a lot of work there. So can you educate us a little bit about what it is, who deals with it, and some of the things you've learned?
Absolutely. It's maybe one of the main reasons why I got these connections between nutrition and the health and dental stuff, because the TMJ means especially and mainly to these muscle function problems. That's so you get cramps in your muscles here, sometimes at night, sometimes in the day, which is a different if you see it on the biochemical way. But what's funny is if you or other way around. When I started this 25 years ago with my colleague, we went to these courses and then we found out, okay, if you change your occlusion, it changes your whole body structure. So if your occlusion is not perfectly aligned or your jaws are not aligned perfectly, your teeth might because of the orthodontic treatment, but it's not always the same situation with your jaws. So your jaws might be offline, your teeth are in line, so you think it looks nice, but because the jaws are not perfectly in line, your spine is not also. So it's a little bit twisted. You've got a little bit of scoliosis, and that's because, and then your hips are not perfect in line too. Then you've got different length in your legs. And that's what I had. And because I thought when I was, I think 18, when I played squash quite a lot or racquetball, and I got always pain in my left knee, and I found out 20 years later that's because of the disbalance in my bite. Then we took a physiotherapist. They fixed my spine, fixed my hip, and then my bite changed a little bit. So I only had contact on my canine on the left side and no contact on the other ones. And then I was able, with my new splint, which we made in this bite situation, was able to run without pain in my left leg anymore. And like I said in my to date, I just told that to a patient of mine. She's horseback riding like my wife, and if you're blocked because your bite is not okay, then you're not able to move your body the way you should do to tell the horse what to do. And if you're a competitive rider and you find out that because your hip is a little bit blocked on one side, then your horse feels that and it doesn't move the way it should. So if you're blocked on one side and not on the other side, then you can move your horse to the right side very well, but not to the left side. And then you think the horse is stupid, but it's not. It's just a communication, because you communicate as a rider with your hips and not with your hands. And if your hip is blocked, then you can't tell the horse what to do. And that was my story to that, and the story of my wife, because she's horseback riding and loves that. And when you see how many patients we can treat, it's usually quite a lot of patients that you get a splint, then you get physiotherapy, and then you get your carpal tunnel syndrome or others problems like what is neck pain, which also can relate it to oxalate problems. You can tinnitus problems because you reduce the pressure in your jaw here, in your joint. And you've got all these digestive issues which are connected to that. And after that, and I found out that there's so many people we can treat, but there are some a special group of patients which we found almost impossible to treat. And that's usually girls at the age of 45 to 65. So they get into the menopause. And then I found out, okay, what's the reason for that? And I dug deeper and I dug deeper, because I said it must be something wrong in this situation. Because why do we don't have guys in this age group? Only girls. And when we found out that you reduce your estrogen when you get into menopause, then you're not able to produce enough collagen anymore. and the collagen helps you to relax the muscles, and the blood supply to the muscles is getting better or worse. And then you have to know that if you clinch really hard here, then you've got a connection to your adrenals, and then you activate your adrenals, which usually, when they're activated, produce um, cortisol and adrenaline. And if you produce that, first, the cortisol destroys your collagen, which is not very good, especially for me as a periodontist. Then for periodontal disease, it's a problem because you clinch so hard that then you destroy your gums on your bone, which is also not very good. And then you go deeper in that, and then you find the connection between the estrogen problem and the histamine problem of your SIBO. So if you've got inflammation in the gut, then you cannot get rid of the histamine, and histamine is connected to the estrogen. And what happens in females in the menopause, they reduce their sex hormones, which is normal. But if you have problems with the histamine, your estrogen goes up and your progesterone stays down, and then you're still estrogen dominant. And then there are some people, like 20% of the population here, and I think it's the same in the US and in Germany for the Caucasians, they have got a problem in your COMT gene, COMT gene, which is the catecholamine methylation system, where you detox your catecholamines like noradrenaline, and also estrogen. So you can get rid of that, and then you get problems with other biochemical pathway, which also increases adrenaline. And adrenaline in your body makes you clinch more. And then when you clinch more, then you reduce your magnesium, which blocks the catecholamine transferase. And if you have got this slow COMT gene, and you've got all these combinations together, then you really are messed up. And then the clinching gets worse and worse and worse. You lose your magnesium, you lose the possibility to produce glutathione, which increases your problem with inflammation, which makes it even worse. And then you try, think about it, and they say, okay, you as a dentist can use a splint, a little bit of plastic on your teeth, and think you can solve these kind of problems. And they say, okay. And then if you can, if you want to, you can go even deeper in this situation with your gut and your gallbladder and all that, like taurine production, which is also involved in that, and your sulfation situation. We say, oh my goodness. And a lot of these girls do not eat a lot of meat, which is, I don't know why, but it's the way it is. Then you have not enough methionine, the only sulfur donator in the from the all the amino acids. So you got lack of sulfur there, which is needed to produce glutathione because it's blocked because the COMT gene is not working, and so you cannot make homocysteine. Um, and that's really, really weird. And then you sit there and say, okay, I'm a dentist. I'm supposed to drill into teeth. I know all that stuff, and I can't help anybody. And that's why you're here talking about you and how you treat your patient. Because it's funny when I saw you, your internet, where you got this Rosetta system, where you said we can treat all these ones. I say, well, that's funny because we treat it with a split, and you treat it totally in a different pathway, but treating it the same way. And that's amazing. But we cannot treat a real deep dive or deep problem into these biochemical pathways, because there's so much going on, and because of the food that they usually eat, they don't eat a lot of methionine, not enough meat. Then they got these transsulfuration problems. They cannot produce enough glutathione. Then they've got these SIBO problems. They've got a lot of inflammation. And as I said, and then we're sitting there and say, well, we're supposed to treat that with a splint. No, we can't. There's no way around it. And then you get all these, because of the catecholamine problems, you've got this irritability, you've got these really difficult neurological problems because you cannot produce serotonin and dopamine because you're inflamed and you can't use your iron in your body. So this is really another pathway, which is even worse. Then you get problems in your marriage because you're irritable and you're really difficult to handle. And as my wife said once, when you can treat this, then you can save probably 50% of all the divorces between 45 and 65.
Good
So
point.
yeah, it really is. If you talk to the boys, they're the same age as I am. They say, "Oh yeah, I know what you mean."
Oh my goodness. Well, I think all of that is absolutely fascinating. And again, I just really appreciate how you're able to put all that biochemistry together and explain all these pathways. And it always just strikes me so much that one diet can have so many different impacts across the body. What is good for the mouth is good for the gut, is good for the brain, and all these different connections that you've made is super helpful. I've learned a lot today from you, honestly, and I really, really appreciate that we've been able to connect, and hopefully we get to do that again in the future sometime. But Dr. Menzel, where would you like people to go to find you and connect with you in your work today?
Well, as my daughter is just trying to build up our internet presentation, and so the Carnivore Dentist would be the way to go to. And we want to do all what we talked today, and we want to put that into small videos and try to help people if they find themselves in these problems, how to get informations, where to go to, where what kind of books they have to read, or they have to if they sometimes need some supplementations in this transition phase, what does help, what is difficult, or like some things might be good or might be even worse to take. So I have to be very careful. And then I try to bring that in a form that it does help a little bit for patients who are interested in this. Because I know it's really a bit nerdy when I talk about all this stuff, but it really does help, and it can really change your life. It can change your marriage. It can change your behavior to the whole public, and it's really worth doing it. And that's why I started to think about going public, because I've never heard anybody talking about the situation between dentists and these biochemical pathways. And there are a lot of people talking about dentistry or biological dentistry, which is really important and it really works, but it misses all the other problems that we're working on, because the patients are a lot more than just teeth and jaw and some material in there. It's not the titanium or the zinc zirconia, it's the whole body. And as I try to explain, it's far more complicated. And I only scratched the surface because I'm not a biochemist. So the carnivore dentist would be good. Yeah, and I try to go deeper in that and probably find more connections to why it's really, really necessary to go carnivore and stop pouring carbohydrates down your neck. It's stupid. It's wonderful. I love wine. I love to have a whiskey. I have love chocolate once a month,
Yeah,
or in summer times an ice cream. Yeah, once or
yeah,
twice a month. Not every day.
yeah.
It's like when I eat ice cream, it's like drinking a glass of whiskey. You wouldn't drink a whole bottle. That's pretty stupid. And so don't do it.
Amazing advice. Well, thank you so very much for all the wonderful education. I think it's awesome that you're putting this stuff out there. We'll link everything in the show notes. And also, if we can find a time that you would like to come back with your daughter, if she would like to be on as well, it would be fun to chat with the two of you at the same time since you're both creating the content.
And
So if she's
that's
not
what
too
we
shy,
want. That's our plan, to do a father-daughter conversation
great.
online. So it's a little bit more interesting than just talking to an old guy talking about meat.
Well, that's awesome. I think all of it is very helpful, and we're so grateful for you. So thank you so very much for all of the amazing work you do, and thank you so very much for being a host on our show today. We really appreciate you.
Thanks for having me. Thank you very much. Bye bye.
Absolutely, it was an honor. And this has been another episode of Boundless Body Radio.